हेलो गुड मॉर्निंग। मैं से डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के पास्ट ईयर क्वेश्चन पेपर। अ पेशेंट विद डायबिटिक mellitus फॉर द past 5 years present with vomiting and abdominal pain. She is non-compliant with medication and appears dehydrated. Investigation revealed a blood sugar value 500 mg per dl and the presence of ketone body. What is the next best step in management? Intravenous fluid with long-acting insulin, intravenous fluid, intravenous insulin, and intravenous fluid with regular insulin. This is the answer because the in clinical vaginity points to the diagnosis of the diabetic ketoacidosis, for which the best step in management of intravenous fluid with regular insulin, because the decay is a complication of diabetes mellitus and it arises due to the relative absolute of the insulin deficiency seen more commonly in patient in diabetic mellitus type 1. If we talk about the clinical features like including nausea, vomiting, abdominal pain and tachycardia, and hyperglycemia leads to volume depletion, subsequent hypotension, respiration, and fruity odor on the breath and are characteristics of this condition. Next question. A patient diagnosed to be retropositive was started on highly active antiretroviral therapy. Which of the following can be used to monitor treatment efficacy? CD4 plus T cell count, viral load, P24 antigen, viral serotype. Here the viral load is the answer because the viral load can be assessed in a antiretroviral in a retro positive patient started on highly active. The viral load can be assessed on a retro positive patient started on highly active antiretroviral therapy to monitor treatment efficacy, and HART or a combination antiretroviral therapy, the mainstay in the management of retropositive patient. If it initiated soon after diagnosis, except in cases of cryptococcal or tuberculosis meningitis. Next question. A female patient present to you with a unilateral headache. It is associated with nausea, photophobia, and phonophobia. What is the drug of choice for acute management? Pronarigine, sumatriptan, propranolol, and topiramate. Here the best answer is the sumatriptan because the clinical visit to here the suggestion of the acute attack of migraine and the drug of choice for acute management of sumatriptan. Migraine is the second most common cause of a headache and can seen common in the women. It presents with the episodic headaches associated with the nausea, vomiting, sensitivity, and sensitivity to sound, phonophobia, and common table include bright light sound and hunger. The sensitivity to sound is also known as the phonophobia. The release of vasoactive peptides such as calcitonin gene related peptide by the trigeminal nuclear cells in the theory used to explain the pathogenesis of the condition, and the neurotransmitter serotonin and dopamine also play a part. Next question. A patient on antidepressant present to you with hypotension and ECG were done which showed wide QRS complexes and right axis deviation. How will you manage the patient? Antiarrhythmic, intravenous sodium bicarbonate, propranolol, and phenytonin. Here the best answer is the intravenous sodium bicarbonate. Here the given clinical scenario along with the ECG changes in the described suggest to diagnosis of tricyclic antidepressant toxicity and the management of the intravenous sodium bicarbonate. Tricyclic antidepressant are used in the treatment of psychotic depression, insomnia, and several pain conditions. Their mechanism of action is inhibition of norepinephrine and serotonin reputed. They have a quinidine-like sodium channel blockade effect on cardiac conditions, hence they cause the what QT prolongation. Other cardiotoxicity effect include like atrioventricular AV block and hypotension. Rightward axis deviation is also an associated finding, and tertiary toxicity can result in ventricular arrhythmias, the status epilepticus, hyperthermia, and coma. It can also result in anticholinergic syndrome. Anticholinergic syndrome due to the muscarinic receptor antagonist. Symptoms include dilated pupils, high temperature, dry mouth, and myoclonic movements. And it is managed with intravenous sodium bicarbonate bolus 5200 mq. This helps to the reverse of a sodium channel blockade, gastric lavage, and administration of activated charcoal. can be carried out in cases of recent ingestion. Next question, a patient present to you with fever, night sweat, pertussis with bilateral facial neuropathy. Investigation showed leukocytosis and bilateral hilar lymphadenopathy. Which of the following is the most likely diagnosis? Here the best answer is the sarcoidosis, because here the given clinical scenario we suggest to the sarcoidosis. Sarcoidosis what is a granulomatous inflammatory condition with multi-system inflammatory. The most common organ affected here the lungs and liver, eye and skin. The most widely accepted etiological hypothesis is an inflammatory response to an infectious or non-infectious trigger as a susceptible host. There are the two syndromes associated with this condition: Sjögren's syndrome and Mikulicz syndrome. Mikulicz syndrome is a bilateral involvement of parotid, submaxillary and sublingual gland, and Sjögren's syndrome is the characterized by erythema nodosum and hilar adenopathy. Periarticular arthritis can also be seen here. Next question, 25-year-old patient is undergoing tooth extraction for dental caries. Which of the following does not require prophylaxis against infective endocarditis? Prior history of endocarditis, AT-septal defect, unrepaired cyanotic heart, 60.4 disease and prosthesis heart valves. Here the septic defect is the answer, is not 60.45. This one is wrong. AT-septal defect is not considered a high-risk condition that warrants prophylaxis against infective endocarditis. Bacterial or fungal investigation of valvular or endocarditis surface of the heart is known as the what infective endocarditis. Large friable vegetation of the heart wall composed of fibrin, inflammatory cells and organisms are characteristics of this condition. Predisposing of the condition include mitral valve prolapse, ventricular septal defect, rheumatic heart disease, intravenous drug use and prosthetic valve. And the prophylaxis against infective endocarditis is recommended drug certain dental procedure and respiratory tract procedure. In patient not allergic to penicillin, we need to give the 2 gram of amoxicillin can be given orally 1 hour before the procedure. Another option is administer 2 gram of ampicillin intravenously or intramuscularly 30 minutes before the procedure. Through prophylaxis is not advised. It is recommended that skin of genitourinary tract infection to treat it undergoing the procedure at this site. आज बहुत यहाँ पे रिकॉर्ड करने में प्रॉब्लम हो रहा है. सो दैट्स ऑल टुडे. थैंक यू एंड कीप रिवाइजिंग.